But thank you again so much for joining us here. This is really exciting. This seminar is part of the ESRC Center for Society and Mental Health seminar series, where we highlight the research not only of our own researchers, but also from across our network. My name is Hannah Kienzler. I am co-director together with Craig Morgan of the Center for Society and Mental Health. So it's a real honor to welcome you. Today's presentation will focus on establishing political priority for global mental health, old challenges, new opportunities. It will be presented by Dr. Valentina Iemmi, who is currently a fellow in the Department of Health Policy at the LSE here in London. Her work investigates broadly how and why global actors support mental health worldwide and how they can improve their collective response to the issue, in particular vis-a-vis governance and financing. So very excited to have you with us, Valentina, and please, the floor is yours. Take us away. I know you have slides. Valentina will present for about 30 to 35 minutes, and then we should have some time for questions. So as you listen, please get your questions ready. I will be chairing the meeting. So thank you so much, Valentina. The floor is yours.
Thank you, Anna, for the kind introduction. I hope that you hear me all well. If not, please do write something in the chat. I will share my slides. Are they visible to everybody? Yes, great. So, good afternoon, good evening, and good morning for some of you. It is a pleasure to be here and to present my work. I see some familiar faces or names in the chat, and it's great, and some new ones, which is even greater. So in this presentation, I will present the results of my work. In particular, one study where I analyzed the process of political prioritization for mental health at the global level. So let's move on. Okay, I will introduce the concept of political priority for mental health at global level. What is it and what we know about it? Then I will present what my study tells us on factors that have influenced the process of political prioritization for mental health. And finally, I will reflect on some key challenges that advocates need to address to increase political support and some existing opportunities that they can leverage. Now, I know that many of you might be academic working with critical theory, and many of what I would say critically gain an extremely useful insight from, and so many of what I would say with my presentation could gain a very critical insight from those theories. There will be some time for question and answer at the end, and I would like to hear your thoughts. So first, political priority for mental health at the global level. When we look at the definition, global political priority for an health issue is understood as the extent to which international and national political leaders give attention to that issue, and the extent to which those actors commit to the issue with financial, technical, and human resources that are commensurate with its severity. If we look at mental health, global political priorities for mental health is very low. On the one side, mental health conditions represent a substantial burden. They affect more than 1 billion people globally, and they represent the leading cause of disability worldwide. And we know that these figures are due to increase due to demographic and epidemiological changes, but also and foremost due to the worsening of social determinants of mental health, such as inequalities. On the other hand, mental health conditions attract little political attention. And this is visible in the fact that only 2% of government health expenditure globally is allocated to mental health, and that less than 1 in 5 people with mental health conditions receive the support they need across the globe. But why mental health attracts so little political attention? When we look at the evidence on factors influencing the process of political prioritization of mental health at the global level, the evidence is extremely limited. A brief paper looks at the process during the years 2000. It shows that advocacy benefited from strong champions that promoted the issue, but it also shows that efforts were hampered by many factors. In particular, they were hampered by a fragmentation of the policy community and their message, by a very limited global governance structure, and by the scarcity of simple solutions for mental health conditions. Now, to gain more insight on potential factors influencing the process, we need to look at the larger literature on political prioritization of other global health issues, such as maternal health and newborn survival. And this literature points to 4 factors required by successful global health initiatives. First, successful global health initiatives require powerful actors to pressure national and international political authorities. Second, they require a clear frame used to portray the issue, and a frame that is appealing to policymakers. They also require favorable political context, and in particular, a strong global governance structure that provides a platform for collective action. And finally, successful global health initiatives have been the initiatives promoting issues with characteristics more attractive to policymakers, such as issues representing a substantial burden, issues having robust indicators, and issues with simple and cost-effective solutions. In addition, we also need to look at another set of literature on global health issues that are highly stigmatized, such as abortion. The evidence shows that stigma poses a unique challenge during the process of political prioritization. Now, let's see how my study contributes to the understanding of those factors for mental health. In my study, I seek to understand why mental health remains a low global priority. And I do so by analyzing the factors that have influenced the process of political prioritization of mental health at the global level and over the past 3 decades. To answer these questions, I use a case study methodology. I conducted 35 interviews with key informants working in international organizations in global health and experts in global mental health. And I also collected documents, both in the scientific and grey literature, but also in institutional websites of key international organizations and initiatives working in global health. Then I analyzed those data using thematic analysis. And I did so by looking at 4 themes, which represent the key factors that influence the process of political prioritization of global health issues, as identified in the literature that I presented before, namely the power of factors, the frames used to portray the issue, the political context, and the characteristics of the issue. And I analyzed the data by decade. And I did so in order to identify changes across the 3 decades. Now, the results showed that global mental health has gained political attention over this period, but that this attention remains very limited. We see this when we look at institutional commitments at global level. such as legislations and policies. For example, during the 90s, there were few international legislations for mental health, such as the UN Principles for the Protection of Persons with Mental Illness. And in that decade, there were also few global initiatives for mental health, such as the WHO Nations for Mental Health initiatives that aim to raise political attention to the issue. During the following decade, the UN ratified an important piece of international law for mental health, the UN Convention on the Rights of Persons with Disability, which include also people with disabilities associated with severe mental health conditions. At the same time, we see UN agencies increasing their work on mental health, and in particular, WHO. In 2001, WHO dedicated to mental health its landmark annual report, the World Health Report, and they launched a series of initiatives devoted to mental health, such as the Mental Health Atlas, which collects data on mental health systems on a regular basis, and the Mental Health Gap, which is a program which produces guidelines on mental health interventions. Finally, over the past decade, mental health was included in two key global frameworks: the Sustainable Development Goals and the Sendai Framework for Disaster Risk Reduction. In the same decade, the work of International Organization of Mental Health continued to grow. In particular, WHO adopted the first mental health action plan and launched an initiative called Quality Rights, which produced guidelines promoting a human rights-based approach to mental health. And we can see that at the end of this decade, COVID-19 elevated mental health globally. And it did so by attracting the attention of several international organizations, such as the UN, the United Nations Secretariat, which dedicated a policy brief to the issue. We also see this limited global political attention when we look at financial commitment for mental health, such as the resources allocated for development assistance. In this figure, we can see the development assistance for health dispersed between 1995 and 2015 across different health conditions, which corresponds to different colors. And in particular, we can see mental health, which is represented with a purple line. This line represents the lowest share of development assistance of health and amongst the lowest increase over the periods across conditions. And to put this in perspective, we can compare it with HIV, which is represented with a green line. HIV represented the biggest share of development assistance for health and the biggest increase over the period across health conditions. But why mental health remains such as a low political priority globally if the needs are so important as we have been seeing at the beginning? So the first reason lays in the power of mental health factors. Their power has increased over the past 3 decades, but it continues to be hampered by 4 main challenges. First, there has been a proliferation of factors over the past 3 decades, and the slides present some of them. Whether the policy community remains fragmented, and this is due to tensions amongst actors with different interests. In particular, there have been continuous tensions with for-profit organizations due to concerns about the prioritization of profit over health. And this includes, for example, pharmaceutical companies such as Eli Lilly, which produces antidepressants, and Now, more often, companies beyond healthcare sectors, such as the bank HSBC, which is part of the global business collaboration for better workplace mental health. Second challenge, there has been an increase in leaders and individuals which have championed mental health at the global level. And you might recognize some of them in the slides. And this includes, for instance, Rosalind Carter, the former First Lady of the United States, Antonio Guterres, the current Secretary General of the United Nations, and celebrities such as Lady Gaga. Whether the number is limited and is limited when compared with other health issues. Then, again, if we're looking at actors, there has been an increase in the role of key international organizations, which have played a crucial role in coordinating the global response to mental health, such as WHO. WHO adopted a global mental health action plan, which is a roadmap for action at the global level. And there has also been an increase in coordinating groups at global level, such as the International Alliance for Mental Health Research Funders, which is a global network of public and private funders invested in mental health research, including actors such as Wellcome Trust. Whether there is no single coordinating mechanism with a clear mandate to coordinate global action. Finally, there has been a proliferation of civil society organizations working in mental health at global level over this period, but they remain few when compared with other health issues such as HIV. And this is particularly true for lived experience and family groups, which advocate at global level, such as, for example, the World Network of Users and Survivors of Psychiatry and the Global Mental Health Peer Network. Now, the second reason why mental health remains a low global political priority relates to frames. There has been an increasing number of frames used to understand and used to portray mental health at the global level, but there is a lack of one clear common message. So frames are hampered by three main challenges. First, we can see that there has been over the 3 decades a low convergence toward a common understanding of mental health amongst the mental health policy community. Mental health is now often understood as a neglected issue, which includes an heterogeneous group of conditions caused by biological, psychological, and social factors, an issue that affect different periods and different dimensions of the life of individuals and their carers, and that requires solutions across sectors. However, there are still many disagreements across mental health factors in the policy community. Mental health factors are oftentimes used in different frames aligned with their own interests. Second challenge is exactly the use of these different frames to portray the issue. We do note that the use of different frames is likely to resonate with a broader audience, especially with policymakers. So for instance, mental health has been framed as, has been framed as a public health issue, a human rights issue, an economic issue, a development issue, or whether exactly the use of those different frames by different actors hampers the establishment of a clear common message. Finally, the third challenge is stigma and discrimination. Stigma and discrimination towards people with mental health conditions and their carers influence the portrayal of mental health and the perception of mental health conditions. Stigma and discrimination are decreasing, and this is partly due to the deinstitutionalization of people with mental health conditions, the integration into society, but also due to anti-stigma campaigns and better media portrayal. Or whether they still remain a challenge. Now, the third reason why mental health remains a low global political priority is the political context. Political context is becoming more favorable to prioritization of mental health at global level, but it continues to pose three main challenges. First, we can see that there has been an increase in policy windows, which are points in time when conditions are more favorable to the mental health policy community for influencing decision makers. And policy windows are increasing. They are also increasingly seized by the policy community. But some of these windows have been missed in the past, and they're still missed now. For example, mental health was not included in the Millennium Development Goals in the year 2000, but it was included in the Sustainable Development Goals in the year 2015. Second challenge, there has been an increase in public and political support, both at national and regional levels for mental health, but this support remains limited. For example, only 9 low and middle income countries have joined the WHO Special Initiative for Mental Health, which aims to promote mental health and to scale up mental health services in low resource settings. Finally, we can see that there is an emerging global governance structure which provides a platform for collective action, but this platform is still very limited. We can see that there are new international legislations. We have been seeing the United Nations Convention on the Rights of Persons with Disabilities. There are global frameworks and plans, such as the Sustainable Development Goals and the WHO Mental Health Action Plans. And there are more favorable informal norms. There is an increasing focus on issues requiring a multi-sectoral approach, such as non-communicable disorders, and an increase in the inclusion of youth and their priorities in decision-making at the global level. And those priorities include mental health, which is one of the leading causes of illness, disabilities, and death, amongst them. Now, the fourth and final reasons why mental health remains a low global priority is linked to the issue characteristics. Again, we can see that over the past 3 decades, those are becoming more favorable to political prioritization of mental health, but they continue to pose 3 main challenges. First, there has been an improvement in indicators to measure the size of the problem and to monitor progress. And this especially at the population level. We can see, for example, the WHO World Mental Health Survey Initiative which collects epidemiological data at country level, and the WHO Mental Health Atlas initiative, which collects data at system level. However, these indicators remain very limited. Second, we can see that there has been an increase in the burden of mental health conditions globally over the past 3 decades. And the figure on the right of the slide illustrates the burden of mental health conditions between 1991 and 2016 at global level and for different country groups, which are represented by different colors. The global estimates are represented with a green line, which shows an upward trend. However, even if we have been seeing this increase in severity, the poor quality of available data is hampering advocacy effort. These figures are often estimates produced using complex statistical models. Third, there has been an increase in evidence-based solutions that are both effective and cost-effective. We have been seeing the mental health gap initiatives and the quality rights initiatives. Or whether most solutions are complex and therefore less attractive to policymakers. So, what do my results mean for mental health policy advocates? My results are highlighting some key challenges that advocates need to address to increase political support for mental health at global level, and some existing opportunities that they can leverage. There are 4 key political challenges. Number 1, the policy community remains fragmented. To address this challenge, advocates could leverage existing global networks of mental health actors, such as the Global Mental Health Action Network, which is a global network of actors working in mental health across the public, the private, and the third sectors. These networks could be used as platforms to solve disagreements and to foster collaborations. Number 2, there is a lack of a coherent public portrayal of the issue. The policy community could use available frames to articulate a common narrative for mental health. Number 3, there is a scarcity of grassroots organizations. Again, advocates could leverage existing global networks of people with lived experience of mental health conditions, such as the Global Mental Health Peer Network. And these networks could facilitate links with grassroots organizations at national level, which could put additional pressure on national and global political authorities. Number 4, there is no coordinating mechanism. And advocates could consider different options that have been suggested by the academic communities for a partnership for global mental health. The partnership could coordinate efforts at global level. Now, alongside these 4 political challenges, there are also 3 key technical challenges. Number 1, there are few robust indicators for mental health. And to address this challenge, advocates could leverage the work of existing organizations, such as the International Alliance on Mental Health Research Funders. The Alliance is currently working on an initiative which aims to identify the most common mental health indicators. Number 2, available data are poor. Again, the policy community could benefit from existing initiatives aimed to improve the quality of mental health data, such as the one run by UNICEF UNICEF is currently designing a tool to facilitate the inclusion of mental health indicators for adolescents to put into survey routinely collect at country level. Number 3, there are a few simple, effective, and cost-effective solutions for mental health. And again, advocates can use existing interventions for which this evidence exists. An example is the menu of cost-effective interventions for mental health published by WHO. Now, I would like to thank you for your attention. And in the slides, you can find my contact detail. You can also find the reference, the full reference for the paper, where you can read more information regarding my study. And now I'm happy to take any questions or comments or reflections that you may have. Anna, back to you.
Thank you very much, Valentina. This has been such an interesting and stimulating presentation, just really fantastic. Thank you very much. We're opening up the floor for questions now. We have ample time to discuss and ask questions. Feel free to put them into the chat, but also raise your hand. I will be supported by Verity Buckley from the Center in capturing these questions. Maybe as you are thinking about the presentation and hopefully coming up with questions, I can just get us started and hope that I will be joined by others. A question that I have, Valentina, was, or something that went through my mind as you were presenting, was the sort of shift that we're experiencing at the moment in the sort of aftermath, or I don't know whether we can say that, of the COVID-19 pandemic, where at least in the UK, across Europe, but also other parts of the world, mental health has sort of come to the fore a lot more. It's being talked about more. There's, at least here again in the UK, hardly a day goes by when it's not mentioned as a headline in the news, for example, right? And so that has really shifted. And I wonder what your predictions are here. I know that your study does not cover the current, very present moment, but sort of looking at the trend, looking at the kind of research that you have been conducting, is there something, are there trends? Do you predict trends to be shifting in relation to these different categories that you discussed?
It's a very good question, and something I've been reflecting and thinking, and especially following the discussions around COVID and mental health. We can see a trend. We can see that during the pandemic, there have been more excitement from governments, from advocates, from the general public on mental health. All of a sudden, worldwide, everybody was talking about the mental health impact of the pandemic. And everybody was united by this experience. Now, I'm using quotation mark because it was not the same experience for every one of us, but it created a narrative that some advocates used to catalyze political action. We have been seeing reports at the global level during COVID on mental health, data collection on mental health at the global level, and comparison across countries. But it seems that all this excitement around COVID and mental health is now winding down. Saying so, the attention is still there. I would say there has been a decrease on the attention on emergency and mental health, and an increase in the attention of climate change and mental health, which is not too far. They're not too far from each other. But there has been a slight narrative shift in that side at the global level. Absolutely.
Thank you.
And prediction, question mark. In the past, the mental health advocates have been extremely useful in using some policy windows. An example could have been the 2004 tsunami in Sri Lanka. And this was really a catalyst point for action in mental health in emergency settings. However, if you follow global action in emergency setting later on in 2014-16, during the Ebola outbreak in West Africa, we didn't see mental health in the global agenda. So a mitigated optimism or realistic optimism.
Thank you, Valentina. Lots to think about. I'm going to Zilper, if you would like to unmute yourself.
Sure. Thanks, Valentina. Can you hear me?
Yes.
Oh, perfect. Yeah. So maybe you've mentioned it briefly, but I'm just wondering, the numbers you show in global mental health priority, do they sort of like change if you disaggregate them by regions, i.e. like LMICs and things like that? So I'd assume that the priority might be higher in high-income countries than it would be in low-income countries. Yeah. What do you think?
Yeah, absolutely. Very good point. We touch into inequalities, and not everybody is having the same experience across the globe. So when we are looking at the data by region, so disaggregating the data, we then see the inequality of the distribution of resources and political prioritization. So we can see that in low and middle income countries, this 2% of global health expenditure allocated to mental health becomes 1%. We can see that development assistance for mental health is not allocated equally to different regions. We have very little in Africa and in certain countries where these resources could benefit a larger part of the population because of the demographics, because of the social determinant of mental health. And this is one of the issues when we're talking about global mental health and where we're talking about prioritization of global mental health. Prioritization for who? For whom? And this is a real important question, absolutely. And that's exactly the reason why it's extremely important to have civil society organizations working at national level, raising their voice at the global level. Absolutely. Thank you, Dilbert, for the question.
Right. Anyone else with a question? So we have a question from Harsha in the chat. So I will be reading it out, I suppose, unless you would like to unmute. So I can read it. If suitable, can you please share thoughts on the thinking of big public advocates like Gates or the Gates Foundation, and if they are following through with any increase, decrease of investment or prioritization based on their strategy?
I like the fact that we can't have a conversation in global health without mentioning Gates. This seminar is no exception. Another good question. So Gates is an interesting actor in global health, very controversial and for very good reasons. It has increased his attention to mental health. First, we have been seeing him putting some private money, not from the Gates Foundation, but from Bill Gates funding, and the venture capital linked to Bill Gates on dementia once his father was diagnosed with dementia. Then we sued the Gates Foundation soon after, putting some money on maternal mental health on the global level, very specifically linked to Melinda Gates' interest in women and girls. They have been also supporting a platform for innovation in mental health linked to the work on global challenges. So we've seen that they are becoming more vocal. Now, is it positive or negative? Is it positive because there is more money? But as many of you know, money doesn't come without string attached and doesn't come with objectives and ideologies. So I believe we should be very careful in, yes, engaging with these actors is, I would say, almost inevitable, but be careful in doing so, being critical and reflective while engaging with them and pushing their action to be ethical and thinking about the sustainability of what they're doing. Are they working alone, trying to promote their leadership in the space, or are they collaborating with existing partners? Are they trying to promote the private sectors, or are they trying to strengthen local capacity and local governments? So by both asking the question and pushing the sectors to ask themselves this question and to change their frame, their actions, their modus operandi, we might have some moderate optimism for that too.
Thank you, Valentina. So here we have a comment and a question by Shukat, which I'm going to read out. So the comment is, I think advocacy and lobbying is the key area in order to bring behavior change among the political and policy level leadership regarding the mental health in their political agenda. So this is the comment, and the question is, what are the key strategies to sensitize the political and religious stakeholders in terms of mental health in their agendas?
I wish I had an answer for that. So as you haven't seen from my results, we are still in the process of pushing the boundaries on creating this political attention and this collective action, political, at global level. We have been seeing that the role of civil society organization have been absolutely crucial, especially at the very beginning, over the first 2 decades, in 1990s and 2000s, in building that interest, in keeping talking and pushing and knocking doors, even when the discussion was not there. Over the past decades, we have seen more discussion at political level, global political level, on mental health, more interest. And this is when new actors are coming into the table and into the discussion with different frames. Now, key strategies, I will say collaborations, if I need to resume it in one word. Creating networks, creating groups that can negotiate common messages, negotiate common actions, and keep themselves accountable. There is no enforcement mechanism at the global level, even if we have international legislation such as the UN Convention on the rights of people with disabilities. There is no global government to hold countries accountable. So a lot of the time, changes happen with shifts in norms. Shifting norms by governments, by the public, by politicians, by the private sectors, and this might be more sustainable. So we have been seeing in the public sectors, we now have a network of countries that are interested in investing in global mental health in humanitarian settings. And they have been strategizing on how best to do so. I've been mentioning the International Alliance for Mental Health Research Funders. Again, this is a network that is thinking about how they can create a framework for investing in researching global mental health that can create research that is comparable across countries, that can have impact across countries, and that is organic, again, by changing their practices at the organization level. And this is happening by changing norms. There is no legislation that would do so at the global level.
Thank you, Valentina. I'm reading out the next question. Is that all right? So that is by Shweta. The question is, please share your opinion in regard to establishing political priorities in LMICs where health budget is minimally low, health needs are high mental health stigma, and almost nil presence of cost-effective evaluations for mental health programs.
Yeah. Another interesting question, and very good point. So, and this is a real tension when you have many issues as a government, when you have many issues that you need to cover and a very limited budget, it's inevitable that you need to prioritize. And I think that low and middle income countries or other governments, so budget is limited in every country in the world for mental health, could really gain in using an integrated approach to mental health. So thinking outside the mental health care systems and thinking in terms of mentally healthy societies. What you can achieve by doing so is not only talking about mental health conditions, but about mentally healthy and collaborative and more politically active, more active in the in terms of participation to social activities and to employment activities in the government. And this can be done using not only the health budget, the governmental budget, but also other budgets. And so it's a matter of the Ministry of Finance then to create the incentive in different government agencies to do so, to allocate part of the budget to mental health because it makes sense. It makes human sense, and this is the most important reason, but it also makes financial sense, economic sense.
Thank you. Anyone else with a question?
Questions or reflections or critiques? Feel free to point out to any opposite direction in your way of thinking.
Yeah, so while we're waiting, maybe I have another question or reflection for you, because as you were speaking, I was struck by the lack of pulling on the same into the same direction, right? And of course, the global mental health arena has been fraught with so much discussion also in academia, where we were not pulling, into the same direction. People focusing on the political and social determinants of health, cultural expressions of distress, normal responses to abnormal circumstances, and that you have this sort of classical global mental health movement. And of course, all these sort of tensions have shifted over time, They're not as they were at the beginning of the 2000s, say, and mid sort of until 2010 or so. But I wonder what kind of effect this had, these huge, sometimes really critical debates. Have they derailed some of that process, or were they really necessary? Because you often don't have these same kind of exchanges in other fields, even though in HIV sort of research we had them, of course, at the beginning, right, where people did not believe in this illness, was highly stigmatized, etc. And yet it sort of turned around, and there's a real momentum behind this, whereas mental health seems to be different, probably for many of the reasons, or all of the reasons that you mentioned. But I was wondering, what kind of role did these sometimes quite fierce debates have on what you're saying?
So the debates have been endless and oftentimes circular. I feel like they start in again from time to time, and we reach the same conclusion, or whether this is the way democracy works. And this is important. There have been conversion or a pushing down of more of a cultural approach to mental health and mental health condition. That's absolutely visible. And to go back to your first question on COVID, it's quite alarming that the focus in the response was all of a sudden on prescriptions and apps. Not thinking about the social causes, not questioning societies at all. Again, very linked with a very specific ideology that have been raising over the last 4 decades. Whether it's really important, and that's the reason why I highlighted that it's really important to hear people working and the opinion of people working with critical and engaging with critical theory, because these are the persons that push you to do better, that put the fingers into the problem and push you to find a solution for it. And this is valid for every frames. Because of the proliferation of factors, we now see this at a larger scale. It's a little bit like entering a room with a cacophony of voices, and it's very difficult to understand what is the discussion about. And yes, you can hear louder voices with a particular frame, reflecting power dynamics at the global level. But you can also find the cultural approach and the more the approach that is questioning even the validity of the diagnosis, that it continues to be there, and it continues to be there and is now backed by more and more and more evidence. And what is interesting is that with the raising of the well-being discourse, mental health and the questioning of the diagnosis has now been combined with those types of discussions.
Really interesting. Thank you. So we're coming to an end. And just to sort of close off with 2 remarks from the chat. So, or also a question, but someone is asking, so Annika is asking whether you would be willing to share your presentation afterwards. So not sure what your policy is with that. So have a think. And then Beto is sort of...
Annika, sure.
Great. And Beto saying the intersectional mobilization is key for the establishment of mental health as a political priority worldwide. And I think that speaks to some of the points that you have been talking about, sort of really thinking about this issue from a systemic systems level rather than sort of individual one. Yeah, well, maybe we could have very brief, now the questions are coming through. So maybe I could take one more from someone who has not yet had the chance, but keeping the answer really short, in terms of civic society organizations, how to get different actors to work together to put mental health on the government's agenda when they themselves have different political views or affiliations. Big question. I'm sure it's difficult to give a short answer, but if you could keep it to a minute, that would be amazing.
I would say this is key, to put everybody together in, let me take the question, to put every civil society organization together. And very difficult, I agree with you. And one of the way of engaging with them and bringing them together is exactly to use and to leverage existing networks where that they already join and that they already see an interest in actively participating too. And then it's a matter of, again, negotiating a common message or creating subgroups of interest and alliances. So even if you create one alliance across two organizations, that's already a positive outcome.
Thank you so much. And here we have a mini evaluation poll. Would be really grateful if you could fill it out. It helps us with our seminar series to improve it going forward. But Valentina, thank you so very much for an absolutely brilliant presentation. Lots of thank yous already in the chat. This was so informative and really, yeah, stimulating the way you presented. So huge thank you. Thank you also to the audience. Please stay in touch. We have a newsletter as part of the center. If you are on Twitter, follow us on Twitter. Would be great to stay connected. And yeah, please email us with questions if you have any, and reach out to Valentina directly if you have questions for her and her presentation. So thank you very much and hope to see you at our next seminar. Thank you.
Thank you, everybody.